Hi Professor Sridevi, my name is Yabi Chin. In this video, I'm going to present the content discussed in this journal article called Query Bot for Retrieving Patients' Clinical History, a COVID-19 use case. Without further ado, let's start with the problems addressed in this article. The first problem will be evolving healthcare needs due to COVID-19. The surge in patient volumes at hospitals requiring quick and accurate information retrieval for these patients to maximize efficiency of care. The second problem is there is no user feedback on existing patients' clinical record retrieval system, meaning that the system will not improve over time and it does not have the adaptability attribute we look for in long term. So the main objective of this article is to develop a query bot information retrieval system that allows clinicians to ask natural questions to retrieve data from patient notes and accepts their feedback, so the bot can improve itself from time to time to improve healthcare efficiency. Subsequently, let me talk about the main methods used by the researchers to create the system. The first step is data preprocessing, where clinical notes of 1.6K COVID-19 patients are collected from 12 healthcare centers. The stop words like patient and is are removed from the notes using NLP. The next step is training query bot model. This step involves three components: clinical BERT, K-means, and user feedback. Let's go through them one by one. Clinical BERT. BERT is an AI model pre-trained on learning mass language model. Clinical BERT model is used and fine-tuned with COVID-19 clinical notes data in this development, so the model can obtain specific knowledge regarding COVID-19. The model can return sentence embeddings that can be used to compare query and clinical note sentences by calculating cosine similarity. The next component is K-means. The computation time for this huge dataset is too long. Therefore, K-means is used to group possible similar sentences into clusters, and each of the clusters will then compare with the query. The highest scoring clusters will be selected as the candidate cluster, and all the sentences inside the cluster will then be compared with the query again to get the initial result. At the end, K-means managed to reduce the computation time of one query from 20 minutes to 30 seconds. The last component is user feedback. The result obtained from clinical BERT and K-means are adjusted based on user feedback. Let's go to results and findings. Although based on these two tables, we can see that when clinical BERT incorporated with user feedback, it achieved a mean averaging precision value of 0.9, which is higher than 0.8 when it incorporated with pseudo-relevance feedback. Besides, we can observe that the null hypothesis stating that the precision value between rounds of relevance feedback is rejected, indicating there is no doubt that the user feedback is constantly improving the precision of the model. So from table 4, we can see that the query "Does the patient have any surgeries?" returns relevant result. So to sum up, researchers developed an NLP-based query bot that handles synonyms and natural language ambiguity in order to retrieve relevant information from the patient chart. The results and findings also show how critical user feedback is to improve model performance. So that's all from me. Thank you for listening.